is the Emergency Medical Minute.
All right, so my medical minute today is a little bit less medical, but still really, really important. So today I had a transgender patient, and Meditech is awful, and our EMR system doesn't have a good way to indicate that somebody's transgender or what their preferred pronoun would be or their preferred name. So it's kind of on us to take ownership of that. And so transgender patients, especially in the emergency department, get discriminated against a lot, and a lot of them don't seek out emergency care because of that. So it's our job to change that attitude. And so if you ever have a transgender patient, it's just important to just objectively ask them if they have a preferred name other than the name that's in their chart, and if they have a preferred pronoun that we prefer to be used. Because we sometimes do have to ask really invasive questions about surgical status, things like that, which they feel is very private and is really invasive. So if we kind of need to justify it, if we do need to know, are you on any medications? Do you have any surgeries? If they're here for belly pain, it's important to know, do you have your uterus? Do you have your ovaries? Those are objective things that we need to know. So yeah, just an important thing to keep in mind, because we can be really, really offensive if we aren't careful with the words that we use with this really sensitive patient population.
We noticed last week that there's either a little star or a little C or something by the name.
Oh.
And last week we checked out what that was, and that was for a transgender person.
Oh, cool.
If you wanted to, it's very small.
Not many places have that update in there, so we'll have to update it.
Yeah, so
it is there.
Cool.
Cool. I don't know if you guys can see it.
It might be registration's job to track that.
But we can see it. I don't know who does it, but
yeah. Another way, it's just really silly, but you could even just put a Post-it on there, so that way when the X-ray tech, or because everyone comes in and they're Mr. Smith, is this the right room or whatever, and they're confirming everything. So if you can say preferred pronoun she, preferred pronoun he, or something, so that way that at least whoever's walking in to help out with all sorts of the random tasks that need to happen in the ER kind of are aware, because I know that it would be frustrating if your gender identity in the computer doesn't match what you feel internally, and you have 8 different people walk into the room and mess it up, and you correct every single one of them, and it feels like your care team's not communicating if that message doesn't get passed along, which is the truth, which is we're not communicating. So, but that's a way that we can try to help out.
That's awesome.
Yeah.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.